This is Dentistry Disrupted with Dr. Craig D. Clayton. I'm a wellness and biomimetic dentist, passionate change maker, social media thought leader, and educator on disrupting the way we approach oral healthcare. Come along with me as we journey towards a healthier and more empowered you. Ready for a Dr. Clayton rant? All right, here we go. I am so fed up with the medical system, the oral healthcare system, dentistry, medical, whatever it is in the personal care system, chiropractics, like all of it. It is so messed up. Okay, let's start with what I think is the primary reason. First, insurance. Insurance is such a ridiculous game. Do you know why? Because they dictate the treatment that patients receive. Okay? They have a platter of options, a menu of options, and they say, we'll pay for these, and then that's it. And they make it really hard to achieve comprehensive wellness, which makes zero sense to me. Okay? So instead of, for example, in dentistry, they're happy to pay for extractions and crowns and fillings, but they don't pay for more comprehensive services. Okay? They don't pay for more consultation time with the doctor. They don't pay for more preventative services. They pay for more reactionary services. And then when it comes to like cleanings, which don't really do much, if we're not doing them effectively, we're just may as well just be polishing the teeth and calling it good, which is kind of what happens. Then the patient continues to have disease because we aren't eliminating the cause of the problem in the mouth, the cause of their bleeding gums and inflammation. We're just polishing off some tartar and some stain and whatever and calling it good. And, trying to get it done in 30 minutes so we can see more patients and that's all, so we can get more insurance reimbursement because insurance is reimbursing less and less every year. And oh, by the way, that applies to fillings too. Let's see how many fillings we can get done in an hour block. Go, go, go. That leads to poor quality. Why? Because insurance is paying less and saying you can only have these things. You would think that insurance reimbursement has gone up since the 70s, but guess what? It's actually gone down. Yeah, so with the current cost of living, doctors are being reimbursed less for their services than doctors were in the 70s. It is just absolutely mind-blowing and infuriating. So that's a big cause. Now, if you talk to anybody in the medical profession, same things. You've got this long protocol of like, well, you got to do this and you got to do that. And they're not forward thinking, right? Insurance is not forward thinking. They're not focused on treating the root cause. They're focused on surgeries and medications. It doesn't work like that. We have to figure out what the cause is, and that is much more creative than the current medical model. Okay, second thing that's let us down, the education institutions. I recently took a course by Dr. Zaghi that is a leading expert in airway health using minimally invasive treatment. He said that in his 4 years of medical school, he did not have a single class on nutrition. This is absolutely unacceptable. Imagine that. A doctor is going to learn how to take care of the human body, and they're not being taught nutritional science. This is like foundational. Instead, they're being taught how to diagnose diseases and then treat them with pharmaceutical treatments and surgery, rather than figuring out what's actually driving it in the first place, which could be a mineral imbalance, a vitamin imbalance, a deficiency in a hormone, a deficiency in nutritional intake. It could be so many other things, and we're just throwing medication and surgery at it. We're not fixing anything, and that's what he saw in the medical system. He saw that people weren't being treated properly with airway. People with sleep apnea, people that had just in general poor sleep were being drugged up and subjected to pretty awful surgeries in severe cases rather than treatment that solves the root problem. It's so frustrating. Dental school. Let me give you another example. Dental school. In 4 years of dental school, guess how many classes I had about cavities? I had one class, 3 credit hour class in hundreds of credit hours of classwork. Okay, I had one. And then I had 4 years on how to cut down teeth, 4 years on how to do fillings, crowns, extractions, implants, bridges, you name it. Okay. I spent so much time learning the technical side of thing and very, very little time even learning how to prevent the disease. And this is what it distills down to. Outside of like the extenuating circumstances of like genetic disorders, other diseases, I was really taught that the primary reason people get cavities was that they don't brush and floss enough, they eat too much sugar, and they're not using fluoride. And what really infuriates me as well and makes me just so worked up is I remember being taught in dental school to not believe patients if they tell me that they're brushing and flossing. If they're getting cavities, they're obviously not brushing and flossing, they're eating too much sugar. So even though they tell you they're not doing it, don't believe them because it's obvious because they're still getting cavities. This is just awful. I can't believe I spent $470,000 on an education about how to treat teeth rather than how to prevent disease. And then when I was taught how to prevent disease, I was taught that these are the hallmarks: brushing, flossing, not eating sugar. And if they're still getting cavities, that they must not be doing those things. I have seen so many patients that come to me that are very educated, that eat a very clean diet, that have cut out, gone to an extreme and cut out all added dietary sugar, like anything refined added to anything, and they still get cavities. They've brought in kids to me with abscessed teeth, and they say, we don't have any sugar at home. My kids do not get sugar. They have fruits, vegetables, they have whole foods, nothing with added sugar. Why are my kids getting cavities? And they've been told, well, you obviously must not be brushing and flossing your kids' teeth enough. Or it's because you're not using fluoride. It's like, just because you don't use fluoride, that is not the linchpin of why your kid's getting cavities or why you yourself are getting cavities. It's absolutely ridiculous. The real reason is that it's multifactorial. We have to control other risk factors. We have to treat the biofilm. It's biofilm. And what's silly is that we learned about biofilm in this caries class, the class about cavities and cavity prevention and whatnot and how the disease looks like on a micro scale. We were taught about the biofilm and the bacteria and how they build and how they can become unhealthy, but we weren't taught effective methods to managing it. And I was certainly not taught this idea that you can change biofilms and change them from being unhealthy to healthy. And that is what we need to spend all our time in. I was taught oral hygiene instructions, don't eat so much sugar, and here's this high strength, ultra strong fluoride toothpaste to use at home. You know what's really interesting? We've thrown fluoride at this problem for so many years that there's emerging evidence that shows that humans are developing resistance to fluoride, that these bacteria are actively resisting fluoride, and so it's becoming less and less effective. If you're a follower, you probably know that I speak out against crowns, and that has been very disruptive, it makes a lot of people angry and have big, strong feelings about that message. But the reality is that crowns are overprescribed. In dental school, again, I spent 4 years learning and perfecting how to cut a crown. We had very, very little time dedicated to learning more conservative treatments like onlays, inlays, overlays that conserve more tooth structure and are great alternatives to doing a crown. I remember being told, this isn't that important because guess what? Insurance, when you're outside here, insurance isn't going to pay for onlays anymore. So you're just going to be cutting crowns. So just focus on that. Like, that's ridiculous in an educational institution. And I know 100% I'm not the only one. My case isn't unique to me. I loved my school. I thought it was great people. But I can't believe, looking back, how stuck the education system is and how much it has let us down. And as a result, we have the majority of the doctors that continue to practice the way they do because that's how they were taught and because that's what insurance pays for. There's no incentive to change. In fact, it's a disincentive to change because if you change and adopt more modern principles of treatment, you have to slow down and treat less patients. And these doctors are already being paid less by insurance. So it makes it much harder to adopt this model because they have to meet their bills. it's incredibly expensive to own a dental practice. It's incredibly expensive to pay a team, a well-dedicated, educated team to take care of our patients. So it doesn't make sense financially. And it's a big leap to leave insurance and go cash-based fee-for-service model, because a lot of patients hate that. And so we have to then grapple with this education component of how do we educate. And so many of us are so technically trained, we don't understand how to educate in such a simplified way to help patients understand that it's worth staying, it's worth investing more, because we're finally going to get them healthy so they can stop investing so much. So really my long-term goals, I want so badly to disrupt the medical community. I want so badly to get other people on board, to fight against insurance, to fight against conventional education systems, and help modernize everything, because we are letting our patients down across the board. Whether we're a chiropractor, a physical therapist, surgeon, pediatric physician, pediatric dentist, general dentist, I don't care what you are, the system's letting us down, and therefore we are letting our patients down. And that has to stop, that has to change. And I feel like we're on that brim. We have more providers that are getting fed up with the insurance game. We have more providers that are waking up thanks to social media and more connecting platforms. And this is the time, and we need people dedicated to this. I need providers that are going to preach this message. I need followers, patients that are dedicated, that feel this is right and want to be part of the solution. We can't change things unless we're sharing this message, unless we're talking about it. We're sending it to people. We're talking with our providers. We have to be very proactive in doing this. Insurance is a big hunger machine. Schools, education systems are very hard to change. Everybody knows that. So it's going to take a big movement of people and providers to be able to create this change. Any dentist that comes at me, any insurance that comes at me, any education system that comes at me, I can say to them, how many courses are you teaching on cavity prevention? How many fees are you reimbursing for cavity prevention? Doctors, how much time are you spending educating yourself on how to fix the disease? Okay, this will stop every single one dead in their tracks, because I know and I'm confident that the majority are not doing this. Do I blame them? Not necessarily. Okay, they have been let down, and they are perpetuating this vicious cycle because there's no incentive to change. There's no big voice on the stage saying this is what we need to do. They're in these underground niches that are considered the fringe of dentistry, like integrative functional dentistry. Okay, so I am confident that I could argue this point to anybody, and we need to change this. And if you're angry, come at me. And if you are in a place of influence where we can speak and have a good discussion about how we can achieve this, let's do it. I really hope I can get more people on board. And at the end of the day, yes, I get fired up, I rant, I get frustrated. I have to get this emotion out because it's so big for me. I care so much about it. My big vision is that 20, 30 years from now, I can look back and see that I've had a hand in changing the industry, not just in oral health, but also in medicine, as just being a person that has been willing to put their head on the chopping block, speak out, and get patients and providers rallied up to create change, and finally move towards more prevention medicine. It makes sense. It's better for our patients, saves the healthcare system a lot more money. It's just, there's nothing better than prevention, and that is what we owe to our patients. Thanks so much for joining me on this episode of Rants with Dr. Clayton. See you next time on Dentistry to be Disrupted.